Have you got a dental implant placed recently? I have got a guideline for aftercare of dental implant and success of the implant from your end. Here are some measures you must do for a healthy recovery. Eat cold food items on the first day of dental implant surgery. You only have to drink cold food items immediately after surgery. This reduces post-operative swelling. Avoid hot drinks or hot food for the first day and do not swirl liquid over the area. Try not to disturb the surgical area with your tongue or fingers. A finger is never good. Do not try vigorous exercise for the first 48 hours. Do not run or go to gym for at least 2 days after surgery. You may have some swelling and/or bruising following your treatment. This usually reaches a peak 2 to 3 days later. This is quite normal, and both will subside naturally after a few days. Swelling can be reduced with ice packs, or a bag of frozen peas, wrapped in a towel. Hold on the cheek area for a maximum of 10 minutes at a time with 20 minutes break. After 24 hours, gentle heat is more beneficial. Sleeping propped up slightly on 2 to 3 pillows may also help. Successful oral surgery depends on keeping the mouth as clean as possible. It would be best if you also start cleaning your other teeth as normal with a toothbrush, starting on the evening of your surgery. Avoid brushing the surgical site for the first few days, but then begin to clean this area with a toothbrush as well carefully, once tenderness permits. Hot salt mouthwashes, a cup of hot water with a teaspoon of salt, are very beneficial for healing in the first week. Ensure that the mouthwash is not so hot that it scalds, and then hold the hot mouthwash over the surgical site until it cools. Repeat as often as possible. Try to keep food away from the surgical area for as long as possible. Rinse following eating to keep the area clean. You are advised not to smoke until the wound has healed, as this severely limits healing in the mouth. Quit smoking for a minimum of 1 week after surgery. It may have an adverse impact on your implant. Pain should not be a big problem. Although you may be sore for a few days after any surgery in your mouth, this can be easily managed with simple painkillers. It would be best if you take these regularly at the maximum stated dose for the first 3 days after your surgery. Take whatever painkillers you normally take for headaches, aches, and sprains. Ibuprofen and paracetamol make a good combination, and take your first dose before the local anesthetic has completely worn off. If you have prescribed an antibiotics course, do not skip the dose. Do salt water rinse from day 2 of surgery to avoid any infection. We want your recovery to be as smooth and pleasant as possible. In case of an emergency, contact your dentist. Press the like button if you like our video. If you want to know more, visit our blog at www.xtooth.com.